chondromatosis or synovial chondromatosis. It is metaplasia of synovium into hyaline cartilage. You can see on X-ray loose fragments of cartilage which is calcified. The patient is complaining of pain and swelling and locking. Knees is the most common place. On X-ray, there will be a popcorn calcification in multiple loose bodies, and treatment is open or arthroscopic synovectomy with loose body resection. Similarly, pigmented velonodular synovitis is called GCT when extraarticular. It's a benign and invasive. Knee is the most common location. Histology is same as giant cell tumor of tendon sheath. It's highly vascular villi formation and hyperplastic synovial cells. There is episodes of recurrent hemarthrosis and mechanical symptoms. MRI is a choice modality, and treatment can be either observe, then radiotherapy or radiosynovectomy, or synovectomy. During synovectomy, you need extra portals, or you will need a posterior approach to open the knee joint and resect the synovium.